everyone's joining at the moment. Just bear with us a moment and we'll start.
Hello.
Welcome, Larissa. Welcome, everyone. We're just letting people in. We'll start in just a moment. Hi, Saba. So my name's Elizabeth Deveny. I'm the CEO of Consumers Health Forum. Just as people are arriving, I'll mention that we will be recording this webinar and then we put it on our YouTube channel so that other people can watch it, or those sometimes people who've registered who can't get here today, they'll be able to watch it later. If you happen to have an AI scribe that just turns on everywhere you go, please note, unless you've asked us if you can have one for accessibility reasons, we'll be booting it out of the webinar. So I don't know if there are any, but just for noting. No worries, Penelope, thanks for letting us know. Remember, you can watch the recording if you missed the last bit. So I'm joining from Naarm, Melbourne. Before we begin, I would like to acknowledge the Wurundjeri people of the Eastern Kulin Nation, who are the custodians of the land I'm on today, and pay my respects to the elders past, present and emerging, and also extend that to all of the First Nations people who are with us today on the call. And some people have started doing it. Love to know where everyone's from. Thanks for sharing, and from Ngunnawal country and Ngambri country. If you pop in the chat, we'd love you to say a few things. Say hello. If you're representing an organisation, we love to know who you're representing. If you know whose country you're on, let us know. It's great to see the whole kind of map become alive in the chat. We see the whole nation at so many different places. Tell us what your pronouns are. Mine is she, her. If you, ask a question, then we know how to respectfully respond to you. Thank you, everyone who's getting into the chat and doing that now. And the other thing I'll do just, my voice is echoing. Is it for everyone or just for Saul? Anyone else getting an echo? Okay, great. Saul, it might be at your end. Thanks for letting us know. We also have a consumer recognition statement, which is here. This is developed by our Consumer Assembly. You can see a few of them in the photo there. And we start all our public-facing work reminding ourselves that the reason that CHF exists, really, is to represent the voices of communities and consumers. Some of you will have seen the statement before, but if you haven't, there it is. And a little bit about us. So many of you, I can see from the names in the chat, have come to more of our webinars and been involved in other ways. Thank you for your continued support. We really appreciate it. But for those of people that perhaps this is their first time they've been on one of our webinars, we are the national peak body that represents health consumers. So a peak body, that means we have organisations who are our members, like Genetic Alliance Australia, Hepatitis Australia and so on. So we're independent. That is that we don't advocate for any particular kind of cause or view. Our job is to represent the varied needs of the community. And this is a really special year for us because it's our 40th anniversary. So feel free to get that react button if you haven't found it yet. We'd love a bit of a party popper. I wish there was cake. There's not. You can send us a balloon or a love heart just to celebrate with us the 40 years. We'll be doing a lot of things over the next 12 months to mark the 40 years, so keep your eye out for those. They're going to be a lot of fun. These webinars are a series of webinars that we do. This is our first one actually for this financial year, and it's on the real cost of specialist care. So we'll be covering a few things. We'll be talking about what consumers are experiencing when it comes to these costs, and what the inquiry that the House of Representatives has begun into access and the cost of specialists is. What is that inquiry? Why does it matter? Why should you be involved, and how can you do that? So great. Thank you everyone for popping things in the chat. That's really fantastic, and thanks for the love about our 40th birthday too. So first, I'm really delighted to welcome a special guest, Dr Mike Freelander. Dr Freelander is a federal member for Macarthur and the chair of the Standing Committee on Health, Aged Care and Disability in Parliament, and is leading a new national inquiry into access and affordability of medical specialists. So without further ado, welcome Dr Freelander, and I'll hand the microphone to you.
Great. Well, thank you very much, and really important roundtable, Elizabeth. So thanks very much for inviting me. I think this is a really important inquiry, and I want to make sure that we hear from as many people as possible. And it is into access and affordability. So it's not just about the cost, it's about access in a whole range of areas, from geographic isolation and difficulty getting to see specialists, from costs, as you've mentioned, from workforce. There aren't enough in certain specialties, and there certainly is a maldistribution of specialties when we look at where medical specialists live and work around Australia. Different areas will have different problems with access, and we've looked a little at this in our other health inquiries. We've just finished one into drug and alcohol problems in Australia, and we've looked at, for example, access to addiction specialists and psychiatrists around Australia. It's very different in different areas. I myself am a medical specialist. I'm a paediatrician. I still work in our local hospital. I do a clinic there. And it's patently obvious to me that this is a problem that has many factors and has built up over many decades, to the point where we have a very inequitable situation in access to certain specialists. And that's important to me as a paediatrician, because paediatrics is one area where there is a problem, and waiting lists in some areas are now measured in years rather than days, weeks or months. And it's a real problem for some of the people problems are, and finding where of every health practitioner in the country, the general public, consumers are the number one focus, and giving voice to people who live in areas that are quite difficult to access healthcare in. And I want to hear from you what the issues that are facing your clientele and others that you know about. And I've spoken to many of my medical colleagues, and to be honest with you, most of them recognise that there is a problem. The focus in some areas of the media has been on costs, but there are many factors involved in costs. And in some of the medical specialties, costs have risen enormously. However, having said that, I do think that there are areas where the costs have, to see a specialist, have increased considerably out of step with practice costs. And we know also that there are training difficulties. We don't have enough specialist training positions in our public hospitals, and that involves state governments. We're still importing about 40% or more of our specialist workforce from overseas, often from countries that can't afford to leave that can't afford to lose those medical specialists. And this is an area that I think needs to be looked at as well. So it's going to be a wide-ranging inquiry. We want to hear from as many people as we can, particularly consumers. We want also to make sure that the people that are most disadvantaged in accessing healthcare get a voice as well. So that includes people from non-English speaking backgrounds, includes Indigenous Australians, includes people who live in very isolated areas, and also areas where healthcare costs are very high. And that in particular can be places that you might not think of, but can include areas like the ACT and Tasmania and other places. So we want to hear where the problems are, for sure. We want to hear from consumers in particular, but we also want to make sure that the people that need support to see specialists in the 21st century can get that support without it being financially crippling. So that's about it. I don't want to say too much more, but I would like to hear from some questions from you. I'd also note that my committee, the Standing Committee on Health, Aged Care and Disability, has a number of really interested and really engaged members, including some other doctors like myself. Monique Ryan is a paediatric neurologist of long-standing and high reputation. Gordon Reid is an emergency physician from the Central Coast. We also have Dr. Sophie Scomps, and we have many other members, including Anne Stanley, including members Sam Birrell from the National Party, and a number of other members who are really engaged in this inquiry. So enough from me, and I want to hear from you.
Great. Thank you so much, Dr. Freelander. So I'd encourage everyone to put their questions or thoughts into the chat, and then we'll be able to read those out as we go. And just while I'll give people a moment to do that, I'll make a couple of comments, Dr. Freelander. So findings from our surveys, such as our Australian Health Panel, shows that 4 in 10 people, cost has a huge impact on whether they seek care, and 7 in 10 have received a bill that was higher than what they were expecting. That's quite a lot, right? And behind those numbers are people making difficult choices, delaying appointments, putting off treatment, maybe using their savings, or having to, go down on the knee and asking people if they can help them in order to get the care that they need. And people do tell us that specialist care is very hard to navigate, that the fees are often unclear. The costs can vary quite significantly, and it can be difficult to know what you'll have to pay until after you've got the care. So today's about bringing those consumer voices into the conversation, but very interested and hoping some people are putting now into the chat, and I'm going to have a look, some questions that they'd like to ask you. And just while I wait for them to do that, I would mention that I think some people will be wondering, gee, like a parliamentary inquiry, that sounds like a big thing. Me as an individual, what do I tell you? And like, do I just write it on a piece of paper and send it in? What do you need to know from me? Because many of the people on this call, they're not from organisations. They're ordinary people who might have, a child that needs paediatric care or chronic disease and need to see a rheumatologist. What's going to be helpful to your committee, and what would you be willing to receive? That would be useful, I think. But folks, do put your questions in and we'll come to them in a moment.
Well, I might very briefly go through that. We are determined to hear from as many people from as many areas as we can. And let me just assure you, everyone will be treated respectfully, no matter from what vantage point they're viewing this inquiry. It is really important to us. I've spent my entire working life in the public hospital system. I want our public health system to be as accessible and as good for people as it possibly can be. I know that this is a major issue for many people, particularly in my electorate. We have a lot of people who are quite disadvantaged and struggling to access healthcare, and everyone will be treated respectfully. Doesn't matter if you write it on a scrap of paper on the kitchen table. If you send it to the Standing Committee on Health, Aged Care and Disability, it will be treated respectfully and it will be examined. We have done some major inquiries around Australia. One on diabetes we did a couple of years ago. We looked at every submission and there was over 700 submissions. And, I think people did understand it was treated respectfully. I'm seeing this not from a political perspective. So it doesn't matter what your politics are. It doesn't matter if you want to criticise the government or praise the government or praise previous governments. We are seeing this for purely a public health, a very important issue to deliver equitable care for all Australians. Doesn't matter where you come from. So you will be treated respectfully, and you will be given the opportunity to get your voice heard, I can assure you.
We've had a couple of questions, Dr. Freelander. One is, sometimes telling these stories can be quite traumatic. Will people be able to somehow say, I want to share my story, but I don't want my neighbours to know? Or if you ask me to come and give evidence, will I be able to do that in camera? Or will I have to do it where the whole country can see me tell my story about, what's happened to me?
Yeah. Well, look, we are quite used to this. I've been the chair of the committee now for 6 years, and we will receive any submission, as I said, respectfully and in the manner in which the submitter wants it to be heard. You can be public and have your voice heard publicly. You can be critical if you want to. We will accept it. We would ask you not to be specifically critical of individual practitioners, because we can't and wouldn't be able to deal with that. But apart from that, everyone will be treated in the manner that they want to be treated. They can be heard in camera. They can have their details redacted, but still have it in the public domain. So you could make it anonymously if you want. And we will do our best to guarantee your privacy, if that's what you want.
Right.
It is important that we hear those voices, both positive and negative, and it is important for us to understand the details of the concerns, where they are from, what sort of procedure, what sort of specialty. That's important for us to understand. But everyone will have the opportunity to present in the manner in which they want to present. If they want to be heard at a public hearing where they actually come and speak publicly to the committee, then that can be accommodated as well. And we are going to try to get to as many areas as we possibly can. Now, obviously, we can't go everywhere, and we've already had a number of suggestions where we should travel to. But we'll do our best, and if you want to be heard publicly, you'll be given the opportunity to do that as well.
Great. And we did hear from your office yesterday that people can also put in a video if perhaps writing's not their thing, and they just rather, talk into their phone. You'll be able to, and we'll send information out about that.
Sure.
Change that so that people can do that too. Because as you've said, Dr. Freelander, however you can get that input, you're really open to it. There are a few thoughts in the chat I'll read out to you. So thanks, Joyce. Joyce has said her friend had her rheumatologist bulk bill her. She thought, oh, that's great. Maybe I could do that too, because it was really expensive. But when I asked, I was told no, because my friend was also a patient of that doctor's husband who happened to be an ophthalmologist. So that's why she was bulk billed, because she was a patient of the husband. And she just wanted to let you know, share that story and say, that seems a very strange thing to make a decision on bulk billing based on who else in the family you might be seeing. So you don't need to make a comment, of course. I'll just share the things that are coming.
I'm happy to comment on that.
Go for
it. Look, it's up to the individual doctor, individual specialist, as to whether they bulk bill or not, or who they bulk bill. It has been traditional in the medical specialty field that other doctors and their first degree relatives, their partner or their children, are not billed by a treating specialist. That's a tradition. Not everyone sticks to it, and it's up to the individual doctor. It can seem to be a little bit difficult to understand why some patients get bulk billed or not. I myself have sat in a doctor's surgery and watched some people be given very big bills and be shocked by the bills, and then myself come up and almost embarrassingly be bulk billed, but that's behind that tradition. As I said, not everyone follows that these days. I think the bulk billing issue is a real problem for specialists because the Medicare rebates haven't kept pace with the increased costs over a couple of decades now, and that is why many specialists don't bulk bill at all, because their costs have increased so much, and the rebates haven't kept pace even with inflation. So that is an issue that we need to look at as well. The government has, as you know, increased GP rebates over the last few years, and I think we do need to look at the Medicare rebates for specialists as well. But that's not the only thing that we need to look at as well. I think we need a bit more competition, and that's always something that drives down prices. And I think we need to look at how we can better use our specialist resources using some new technology like video conferencing with GPs about individual patients, etc. And I think that's one thing that we're going to look at very strongly, is how we can use new technology to make accessibility and costs of specialist care much better. As I said, I don't have any biases. I think that there are, look, I shouldn't say that. We've all got biases, but I think on the whole, I think we need to look at new solutions, not old solutions, for this accessibility and cost, especially.
Yeah. So Saba said she wishes that timely access shouldn't depend on your postcode. This feeling that there are a lot of resources in the cities, but attracting to rural and regional areas is really tricky. And retaining them too, even if you've got them, how do you keep them?
Yeah. Look, this is a really complex issue, and something that has really come to the fore in the last 10 or 15 years. A lot of the medical specialty workforce in my age group that has practiced in rural and regional and remote areas are reaching retirement age. Many of them, and I can speak firsthand about this, many of them are finding it very difficult to get replacements, to come and live in the particular rural area where the specialists are practicing. I've had a lot of conversations with my paediatric colleagues about this, who are, ring me all the time saying, they want to retire, they can't find someone to replace them. They're worried it'll be just a locum or a fly in, fly out person. And on the whole, they don't deliver the best quality of healthcare. I don't want to be too judgmental, but.
Yeah. There's some comments too about waits in public health to see specialists, which is, your bread and butter, and people talking about how the wait times are too long, as you said at the start.
I missed that. Anyway, look, it's a complex issue, and it's something we will be looking at, and something where we need to look at new technologies and new solutions.
Yeah. I think there's a lot of comments in the chat about the length of time people have to wait for a consultation, both publicly and privately. That's a problem.
Yep.
A little bit of support for the medical cost finder, and doing more work in that space, which we know the government wants to do. Yep. And also some comments about the need for better informed financial consent, which we know is another thing the government's pursuing, yes. Because people, when they finally do get that consultation, not sure what the cost would be. And then there's also a bit of a conversation about people who need to see multiple specialists, and so that can become tricky too if you've seen one but haven't been to see the other one, as well as, of course, the costs of seeing many. And yes. A bit of a conversation too about how private health insurance doesn't cover secondary care, really. Yes. They call it private health insurance, but it's really private hospital insurance, isn't it?
That's exactly right. Look, I think the issue of private health insurance covering consultation that's not in hospital can lead to a two-tier system where people who have private health insurance get better care than people who don't. And I don't want to see that develop in Australia. And I think that was something that we very much fought about in the early days, initially of Gough Whitlam's Medibank, and then later with Bob Hawke's Medicare. So that is a difficult area. I think that there are some solutions to the multiple specialist thing, and case conferencing and video conferencing can help with that with the GP. It takes quite a lot of organisation, and in the short term can increase costs, but in the longer term, I think it provides better care. Particularly these days, we're living older, and we want to stay healthy. We often have multi-system disorders, be cardiology and neurology, or renal medicine and rehabilitation, a whole range of different specialties some people need to see, and that's where we need to use these modern, digital mechanisms of getting good healthcare, etc. Particularly for people who live in rural and regional areas and very difficult and remote areas. I mean, we have been to places like the Torres Strait. We've been to places like the APY lands, Central Australia. Very difficult to get high-level care there. Yet we have people often with complex disorders, with diabetes, renal failure, cardiovascular disease, visual impairment. Very complex to get multiple specialists involved there, but we can do it if we look at modern solutions. And I think that's something we're very much going to look at. The other issues around seeing multiple specialists, of course, it just adds to the costs. And that's something I'm very conscious of, because these days, as you've mentioned, people do often need to see multiple specialists. And that's can be very true in women's health, for example. It can be very true in paediatrics, where you may need to see a neurologist, a developmental paediatrician, metabolic paediatrician. It's very complex. It adds to the cost, and I think we do need to be conscious of looking at new solutions to what are long-standing problems in that area.
Yeah. So there's a very lively chat going on, Dr. Freelander. What we'll do is we'll cut and paste that and send it to your office so that you can read it over a cup of tea one day.
That'd be fantastic. That's part of the function of the committee. We need to hear from individual people.
We're going to do a poll, and I'd love you to stay if you can just for a moment to see it.
Sure.
So we're going to put that now up on Zoom. We won't be able to do it, but everyone else can. Asking them what are the biggest issues with specialist cost. So you need to see it there on the screen, and people can nominate more than one, from the one that's most important to the least important, like out-of-pocket expenses, navigation, and so on. So we just leave that up for about 30 seconds or so, and everyone just clicks their buttons, and then we can send those results to you too, but they'll come up on the screen in a moment. And I thought you might like to just get that kind of quick vox pop. What are the people on this call thinking?
That's great.
The key things. Is it the out-of-pocket? For many of our rural consumers, it's the travel and the accommodation expenses. Even if they can get to a public service, like say they can get down to see John Boffa's mob at Congress, where do they stay? And then if they've got to go to the hospital, how do they afford travel back? Or if they're in Aunty Maureen Woodward's area and they've got to go up that central Queensland, Northern Territory corridor to get help, and there's only a milk run once a week, and an appointment comes up, what do you do? Someone's just asking, one's your highest priority, I think, Sue, and then 5 is your lowest priority. We'll just give people a few more seconds to pop their answers in. Not everyone will necessarily complete the poll, but we will get a sense from people about what the top issues are.
Yeah,
so I might just
sorry, go on.
Yeah, go on, Mike.
I was just going to say one of the other issues you just brought up there about the length of time it sees to see a specialist. I was speaking to one of my friends who's an ophthalmologist, and she's very worried about older people who, have macular degeneration. Sometimes if they have to wait 6 months or more to see an ophthalmologist, they can go blind in that time. And that's a terrible, terrible result for the individual patient, but also for the whole economy, and something we've got to try and avoid. And she has told me she thinks it's already happening.
Yeah, Macular Degeneration Consumer Organisation is one of our members, and we often talk to them about these very issues. So let's see what the poll results are. Here we go. Hopefully you can see those, Dr. Freelander. So out-of-pocket costs is the number one for most people. You can see there.
Yep.
Then you see down the bottom, like navigation and delay are probably the next biggest issues.
Yep.
Then comes lost time and travel, noting that we'll have people that are in the city, so maybe for them travel's not so big a deal. If we did something saying where do you live, we'd probably get slightly different results. Again,
Yep.
we can send this to you, but there's just a bit of a sense. You can see that very strong sense of we need to deal with the costs, and there's a lot of conversation going on in the chat about, why are things so expensive and what's a living wage and what does it mean if you can't afford care and somebody else is buying a second house. That there's a bit of that conversation going on too, because as you rightly pointed out, you might lose your life, you might lose your sight. These are real issues, and I think the community is incredibly grateful that you're chairing this very important committee and looking forward to the results of that soon. I know you need to go, so can everyone get their react buttons out and send Dr. Freelander a lot of love and thank him for being here today. I hope you can see that, all that love coming your way on the screen.
That's very kind of you. I have put off my next appointment, so I have got some extra time if you'd like me to hang around a little bit longer. I'm very kind of everyone to send me that love. I do feel it, and I do feel that there is a big responsibility in running this inquiry and making sure people can get access to care. One of the things I was just going to say is that sometimes the access can be very difficult, even in the cities, particularly for people who maybe don't have English as a first language or maybe have cultural difficulties in seeing doctors, specialists, and getting through the maze of what is often a very difficult referral process in the public hospital outpatient system. And that's another area where I think we can do a lot better if we work with the states to improve access to the outpatient specialist clinics. And that means dealing with sometimes those who've had the most difficulty accessing specialist care. And it may not be in the populations you think of immediately.
Yeah. So it's just reflecting that that's probably more love than you normally get in the Parliament when you give a speech. So I hope you did really enjoy that.
I did enjoy it, and it's nice to get some positives from people and people who are looking for solutions.
And there's a lot of conversation in the chat too, Mike, about equity.
Yep.
An equity issue broader than health too. So if you're not well, you can't work. If you can't get your teeth fixed, you may not be able to eat, which could then lead to and also impact on further chronic disease occurring through, digestive upsets and so on. So
I'm glad you mentioned dental care, because we as a committee in general think that better access to dental care is important and something we've not dealt that well with in Australia for a number of years. Monique Ryan, the member for Kooyong, who's a paediatric neurologist, thinks that we do need to look also very strongly at how we can include a general Medicare benefit into the dental system. And I agree with her. And it's nothing worse than seeing a young child with terrible dental caries who can't eat properly and is embarrassed about going out in public, or an older person who can't eat decent food because they don't have proper dental care. So that's something we are going to try and address as well.
So send Mike some love if you think they need to get dental into the inquiry, and that's important. How important do you think it is that a dental gets addressed? So I'm sure you'll get a strong vote of confidence for that as well. Look at that.
That's amazing. Yeah. Right?
Well, very strong. And we see that in our work as well. So really great that you can stay on, because the next thing we're going to do is we're going to have a bit of a conversation between Aunty Maureen Woodward and Sobia Shah, two of our consumer leaders, and they are going to talk a little bit about their experiences. So Aunty Maureen works to represent a community by sharing her lived experience and advocating for rural and remote areas. She lives on Bidjara country, and she's passionate about ensuring that consumers' voices are not only heard but respected, and that loop gets closed, right? So we do a lot of yarning, but then nothing comes at the other end. We need that. And Sobia is a passionate and amazing consumer advocate with a lot of experience in multicultural health, social justice, and so on. And she lives on Wajak country, and she really wants to advance the right of both refugees and people seeking asylum, and has led a lot of campaigns in Western Australia to do that. Now, Aunty Maureen, I'd love you to start first, perhaps by talking to us about what does cost mean in a broader sense for you when you're thinking about specialist care?
Welcome, Doc. Good to see you here. Hopefully we get to see you a few more times. Would be really lovely. So I live in Tambo. I live in central Western Queensland, which is a few way away from a specialist. In my situation, I had lots of operations, but I had my spine done last September. Went to see the doctor, who's a specialist. Went top cover. I said, I'll go with me private health as high as I can go with the gap. Well, no, that's not true. So $25,000 later, and I had to hock my house to pay for it. So, but it's the whack that you get when you don't know what it's going to cost you out of pocket. So I've been in pain and living on high doses of medication for a number of years, and I'd had enough of it. And it just needed to get it sorted. So when you mention back, people go, yeah, nothing wrong with you. But I've got what, 4, 5 and 6 with a big steel rod up my back. So there quite obviously was something wrong with my back. But I'm not the only one in this situation. I live in rural remote, as I said, and to get to a specialist, I take a week to get to Brisbane. I have to get someone to take me. So that means whoever, my husband has someone with me. And all that accommodation and that PTS thing, I would like to tell you what to do with that. But anyway, and the cost of travel, it's just a laughing matter. It's just a joke. $70 a night for accommodation is ridiculous, and 34 cents a kilometre for fuel is, when fuel's $2.80 a litre. I don't know what they think. People aren't going to see doctors because we can't afford to. When you look at the cost of food's gone up where I live, power, everything else. And I'm not having a big whinge about where I live because I like where I live. But it's just, you've got to think whether you actually want to see a specialist or you just suck it up and live the way you are. And which is mostly young people, old people, all of us are doing the same thing. We're saying, well, I know I need to keep a roof over my head and food in my belly, and bugger the rest of it. I'll just live with all the pain medication. Medication's free because you go to the hospital, get your tablets. It'll only cost you the script. But when you've got to go to Brisbane and travel away and all the inconvenience that goes with that, you have to think twice, really and truly. And if you're a pensioner, which we all are, or if you're a low income earner, you don't have that spare money in your back pocket. It's not there. So I find it very difficult. I've had a lot of community members come to me because I represent my community as well with women's health. I've had a couple of girls come to me who are 21 with endo that have had their appendix taken out because of endometriosis. How do we not know that the difference between women's health with endo and appendicitis? And this is what happens when you live with, because they start taking the elimination of things away to see what they can find what's wrong with it, because no one actually knows, because you can't come to a specialist down the city to find exactly what's wrong with you. So they just start chopping bits out here and there. It's horrific, does happen. If there's anything anyone would like to know or ask me, I'm quite free to answer any questions you have.
Well, look, thank you so much, Aunty Maureen, for sharing that. Talking about making the decision to sell your house so you could afford much needed care. I'm sure Dr. Freelander will really appreciate you being so open about sharing that. And your commentary about the patient accommodation and transports, which is run by the states and territories in every state and territory, is one we hear often that the state might provide you, are nowhere near sufficient, like $50 a night for accommodation in a big city. You're not going to be able to accommodate yourself. Recently in Darwin, a lot of people sleeping in the long grass. People saying why they're doing that. Well, if they have to go to the hospital, where else they're going to sleep, because there's not enough money for them to actually stay in a hotel, which is what I was doing. I'd like to go to Sobia now, and I'd love you to talk about what cost means to you when you're making those decisions about accessing care. Thanks, Sobia.
Thank you so much, CHF team, and thank you so much, Dr. Freelander, to be joining us today. In my view, when we talk about the specialist care, many people think only about the consultation fees. But for many families, especially migrant families, the biggest cost is that they don't access care at all because they simply cannot afford it. The result is years of pain, reduced quality of life, stress for whole family, and health condition becoming worse. As a live experience, living more than 7 years with the chronic pain, I can simply because the specialty treatment has been unaffordable and public waiting list has been extremely long. It's not only impact my health, it also impact my family. I can't spend time with my family. I can't many opportunities I can't avail it because of my health issue. And also I would like to draw the attention towards the neurodevelopment for the kids especially. Um, I work with the families who are from the migrants and from refugee and asylum seeker families. What happened when they have a small kids, and I witness that they can't get the private pediatrician assessment for children with possible neurodevelopmental differences and learning difficulties or cognitive concern, just because of they can't afford it. And if they are waiting in a public, it's too long, and the early intervention is not possible. After 2 or 3 years, they get the number and they are in a queue. They are just waiting and waiting. And I think that intervention they need very early. But the pediatrician cost is so high, they can't afford it. So we are not only impacting our lives and health, we are also impacting our coming generation. The early intervention can be very, very good for our generation. So I think these two, for me, the cost is not only the real cost of the specialist care. Um, it is also this is not just a medical bill. It is the years of pain, declining health, lost opportunities, and the impact of on families when the people cannot access timely treatment.
Yeah. First of all, can we give both Aunty Maureen and Sobia some love too for sharing their stories and the stories of the people that they support? Two phenomenal leaders. I'm sure they'll be fantastic to appear before your committee, Dr. Freelander, but I might just ask if you wanted to make a response to the things that they've said before we move across to Tom.
Yeah, look, I'd love to give them both a response, and thanks very much, Aunty Maureen and Sobia, for your incredible advocacy and the things that you are talking about are really important factors in people not getting equitable access to care. If I can start with you first, Aunty Maureen, and I should mention that I come from Dharawal country, and I've worked with our Aboriginal Health Service, Dharawal, for over 35 years, and I have the highest respect for our Aboriginal Controlled Health Service. They do a wonderful, wonderful job, but they do provide a one-stop shop for many people, and we get people from all around the country coming to Dharawal because we do have some specialist clinics, and we do provide also access to Centrelink and housing and a number of other opportunities when they come to the health service, and they really do provide the best model of care that I've seen anywhere, and I've seen places all around the world. So it is a complex issue if you treat an Indigenous person, for example, with kidney failure, because often they have to come from a long way away to get dialysis or get access to a kidney specialist. Their family often has to come with them. They may not have English as a first language. They may have difficulties in a whole other range of areas like cardiovascular health. And the cost is compounded time and time again by those access issues. The actual cost to the community would be much, much less if we could provide them with timely access to proper care and prevention and preventative health. So you can't use the economic argument, it's very expensive, when the cheaper option is to intervene early. And Sobia, what you have said about children with neurodevelopmental issues, I've looked at very closely around Australia. And our models of care are very old-fashioned, and they're very counterproductive in a way. You know, the long waiting list to see a paediatrician often mean kids miss out on early intervention, which we know works. You've got a child with autism, we know that if they get early intervention, their prognosis is much better. Diagnosis in these kids is often very important. If they have a inherited metabolic disorder, often treatment can prevent damage. There are new treatments for some of the genetic disorders that, if they're picked up early, can be curative, and that's increasing. So early intervention, early access to specialist care can be really, really important. I recently saw a young infant who had undiagnosed hip dysplasia, and she had been waiting over a year to see a paediatrician, and she now will never have normal hips. Even intervening now, she's almost 2, and she needs operation and a spica and all sorts of things. But even with that, she'll probably never have normal hips. If she'd been picked up under 12 months and certainly under 6 months, her prognosis would have been much, much better. So it is a reality that is happening now, and we have to try and turn this around. And, you know, I think there are some ways that we can do that. I don't think people should waste that long. And if I can just mention very briefly, nurse navigators or health navigators, I think are really important. And we know, you know, it sounds like a bit of a cliche, but the McGrath Foundation, you know, they have the pink day at the cricket, raising money for them. They pioneered this idea of illness navigators, and they've actually shown that the prognosis for people with breast cancer is much better if they have an early navigator that can help them get access to the best specialists and the best types of care. So we know this is a model that works. We've just got to try and get it into every area and every major disease category, and I think we can do it. It means looking at healthcare in a slightly different, less hierarchical fashion that, you know, doctors of my age group grew up with, but I think are probably no longer fit for purpose for the modern era. So I think there are solutions, and that's what we need to be looking at.
Thank you so much. I think everyone can hear the passion and the commitment and the kindness in what you say, Dr. Freelander, that you understand that the issues for community and how important it is that this is addressed, because we are talking about people's lives. One of the things that CHF's doing is our board has got a little bit of money from the small amount of shekels we have, and we are gathering about 20 stories from individuals around Australia to map out in detail what that looks like, and we'll be providing that in our final submission to the committee. So you'll get a really great sense from all around the country. And obviously, as you can see today, we've also got a couple of hundred people that have subscribed to this who are all keen to input into the committee itself, and we're doing whatever we can to support people to feel safe, as you said, and respected, and also to show them how, like, what does that look like if I'm going to do this. So I'm going to throw across to my colleague Tom, because now he's going to lead a bit of a discussion, and you're very welcome to stay, Dr. Freelander, for as long as you like, of course, with Sobia and Aunty Maureen talking about, well, how do you do this actually? Because it can feel a bit big, right? But as you said, it doesn't have to be complicated. So thanks, Tom.
Thanks, Elizabeth, and thanks, Sobia and Maureen, for sharing your insights, and thank you, Dr. Freelander, for being so open to hearing from consumers and community, you know, as chair of the committee, and also referencing that your colleague, the deputy chair, Dr. Monique Ryan, is equally interested in hearing these voices and hearing these submissions. So I want to get into the sort of brass tacks and actually talk about how do we actually make a submission. So everybody shared some harrowing but really insightful insights that I think will help the committee in formulating their decisions and recommendations. So happy to jump to the next slide. So it's a little bit complicated. So you've got to go onto the Australian Parliament House website, and you need to create your own account. So as you can see in the slide here, you put your and Al's put in some dummy data in there, and you create your account, and we will send this through after the slides and some very detailed instructions for everybody. And so yeah, so you'll log in and you'll get your profile, and then you'll get in and you'll say, I want to make a submission, and you will type in specialist into that box there. And then the access to affordability of medical specialists will pop up. As we heard earlier, it is possible to make a video submission, and so I'll give some details about how we got from the committee, from the secretariat of the committee, how to do that, or an audio submission. So we can go to the next slide. So in there, you'll put in your personal information, or if you're representing an organisation, this is the information that you need to include. And we can go to the next slide. And then there's a very important thing, and this goes to the issue of privacy. And so this is about whether you want your information and your contribution to be published on the submissions page or not. And so on a confidential basis and not. So this is a really important part. And so this goes to, you can contribute, and, your voice is there, but you don't have to be worried about other people knowing probably some really traumatic and horrible things that might have happened to you, and to share that. So we can go to the next slide. And so this is the fun part. So you can submit it as a PDF, a document, a docx, or a text. So to do the attachments, that's all that the system will accept. So it's really important. But if you've got a Word document or a Google Doc, you can do that. All right. And then you hit submit. All right. So here's the exciting part. If you want to do a video or a voice recording, or even send an email, because, that system is hard, you can send a OneDrive, a Google Drive, a Dropbox, or another file sharing link. And you can, you've got some example text there. Please see my video submission. And you can put your name. And importantly, you can say whether you want it as part of that email from that privacy one, whether you want it to be published and shared, or whether you want it to be a private one. Yeah. Great. So I'd like to welcome back Aunty Maureen and Sobia to join me now. And we would love to sort of ask questions of you about your experience in responding to parliamentary inquiries. And Sobia, can I ask you how you've gone in terms of doing a parliamentary inquiry submission before?
When someone asked me, actually some couple of the organization they asked me that there is one standing committee, and they're asking for the young children and young people regarding the support for children and young people who are traumatized during the migration. So I thought it's really technical thing, and it's not easy for me to do it. Then I just research it and do it, and then I feel like I need to show the different stories. So we involve the lived experience in that, and I am the lived experience as well. So I use that one in our submission. So that one, I would say, you don't need to be very experienced writer. You need to be show your willingness to make a voice or raise a voice for other people and for yourself as well. So the experience was good. and it's a good submissions when you write and when you explain the things to the other people, especially the policymakers. You feel like you are doing something for the community, and they bring, and you can be here when you are submitting a submission, and you also feel like you are mentioning the different gaps wherein a policy we have. So it's a good opportunity um, to raise your voice and to give the idea what is the gap we have in our policies.
Thank you, Sobia. So I think people might think that, you know, doing a submission is quite daunting, and, you know, when you go onto the Parliament's website, you might actually see that, you know, organisations and people write big,
Yep.
you know, 20-page submissions, and you go, oh, you know, I can't quote all these statistics, you know, but you know, you don't have to fill it with statistics.
Specialize, yeah.
Yes, it can be your story. So, Aunty Maureen, you know, your story that you've shared with us now, that's a submission that you know, is valid and will be accepted by the committee in its own right, and, you know, it's important. I know we've had some questions about, and potentially we might pull Mike back in on this at the Q&A at the end if you're still around. But
Yeah.
we've had questions about, can you submit submission in languages other than English, which is a really interesting you know, question.
Yeah. If I can just step in there, people, I know have raised some concerns about the daunting aspect of submissions, and in previous inquiries, we've had people physically write letters to us saying they don't have a computer, they don't use email. Can they still make a submission? We've made a decision in this inquiry that wherever possible, we would accommodate any submission, right? And whether it's a written submission in a letter, whether it's someone who speaks another language, or someone who feels they can only speak to us face to face, we have made a decision that wherever possible, we would accommodate those needs. Even though it's not on the website, it's up to the committee to decide whether to accept things as a submission or not. So that's my answer. We will do whatever we can. If people write to us in another language, if people can only write us physically a letter, if they can't use email, if we can identify them as an individual, we will accept their submissions.
We've got a great question there. Will they be provided translators, interpreter services if one wants to submit via a video? So if people are giving evidence, Dr. Freelander, at the inquiry, you know, either online, will the Secretary of the Parliament have translators available?
We will do our best. Face to face, it's a bit easier to have translators, but it can be organised online. There is a certain cost sometimes to that that we would have to accommodate. But, you know, I'm willing to do whatever I can to accommodate people's submissions. And, you know, translation, official translators are important. We've done that certainly with the people from the deaf community, for example, had Auslan interpreters available, both online and physically. And if we could accommodate people who speak another language to give evidence to us either online or publicly, I would do my best to organise it.
Thanks, Dr. Freelander. So I can see Aunty Maureen's pop back, and of course, living in regional areas, internet is often, you know, sporadic. And so whilst you're here, Aunty Maureen, I'd love to ask you, what would you like to tell the House of Representatives inquiry if you were doing this submission, and about what needs to change? You know, what's your policy advice to the committee? looks like I've lost Aunty Maureen again. Sobia, I might ask you the same question and we'll see whether Aunty Maureen comes back.
I think in my view, everyone know what is the gaps and everyone know where is the gaps. The problem is how we can fix it, and how we can fill these gaps. The first thing in my view is the specialist monopoly. We need to we need to address this one first, because once we fix this one, it could be possible that the more people are get care very quickly. And there is another reason why there is a monopoly, because in a hospital there is because I'm working with the Professional Migrant Women Network, where the overseas doctor come to us when they start as a GP and they don't have a place for the specialists in hospitals. We are very few numbers of specialists in a field. So one of the reason we can increase the specialist doctor, and we can put more money in a public hospitals, so the people don't need to wait for a long time. Another thing in my view, the people should be treated by their health need, not because of the financial they can afford, and just because of they can afford, they can get quickly address their health issues. So in my view, I think these two things are really, really important to address first. Three actually, because I mentioned three: increase in the specialist number, monopoly we need to address, and the third one is we need to go to the more need of the people, not the on a financial base. Thank you.
Yeah, well, I mean that if I can just interrupt again, that very much is the heart of Labor's view of the healthcare system. That it should not depend on how much money you have, the type and quality of healthcare you get. That was Gough Whitland's great mantra, and he's my great hero. You can see his picture behind me there. That's part of the Labor's reason for being. It's part of our blood. We believe in that. That's why we want to try and change this around. There's also some questions. I think someone's written about why aren't we using nurse practitioners? Well, I think it is important that we use nurse practitioners and, as I said, disease navigators to really improve access to the best healthcare we can provide. So we do, and we'll look at all these solutions, and it is important that we do that. It's not, believe me, everyone on the committee really wants this to be a landmark time for us, that we do turn things around. And these are the sort of solutions that we will be looking at.
Thanks, Dr. Freelander. So I'll, Maureen, Maureen, you're back.
I tell you, God, you've got to love technology, haven't you? What happened to the old telephone where you could just pull up and have a conversation with someone? Anyway, hey, Doc, lovely to meet you. Lovely to have a conversation with you. I'll put my hand up if you need someone to come and have a yarn to you about all this stuff that happens out here. I would love to be a part of that. I represent the Indigenous community, also rural and remote, as to where I live. And I'm very passionate about it. I represent my community in lots of different areas to try and make sure that we are actually heard where we live. I'm not saying a voice, because that's a thing that's gone by the way, but to be heard and to be listened to is so important to my community. There is no magic wand. I don't think I can't call you a witch and you don't ride a broom, and you haven't got a wand, so that's not going to fix it. But we can work together with trying to solve some of it. If we can work small steps, low-hanging stuff that's easy to fix, and we'll start going to the top of the tree eventually. But this is stuff that just hasn't happened overnight. It's been going on for years. The further out you live, the less your people want to listen to you, because our numbers aren't the greatest, which is not fair. If I lived in Brisbane, I would have got my treatment around the corner instead of having to take time away and all the stuff that goes with it. I'm fixed. But anyway, I'm a bionic woman now, but at a lot of cost. You can see I come from the sticks, don't you?
No, not at all. I think I think a lot of what you've said is to the heart of what our committee wants to do. I mean, you've had to wait a long time for treatment. You had to put up with lots of delays. You had a lot of out-of-pocket expenses. Those are the sort of things we want to address. Look, I'm sorry, I will have to go, but I'm happy for people to contact my office. I'd love to get some of the data from what you've presented today. And I thank you so much for having me on. I've really appreciated it.
No,
Okay,
we appreciate your time.
We
Yeah,
really
a big
appreciate.
thank
Thank
you.
you so much, Doctor. Thank you so much.
Thank you. Good. All the best. Bye-bye.
Sorry about the deck.
Thank you, Dr. Freelander. It's a nice segue to welcome back Elizabeth to finish up with our Q&A session. So back to you, Elizabeth.
Thanks. So we're going to have some questions now, which you can direct to Aunty Maureen, to Sobia, or to myself or Tom, as Dr. Freelander's leaving us now. So if you've got any questions, there's a lot of comments in there, but if you've got questions, we'll go through and find them, but also feel free to pop new ones in the bottom of the chat. So we've got a few minutes to talk through things. We're hoping that we've simplified the process and given you a little confidence to actually go ahead and put in this inquiry. Get a piece of paper or, open a Word document if you've got a computer, get a young person in your life to take a video for you, and then we'll send out those details to you about, well, how do you then get that there? I love the idea that you bring a friend. So you could have two people doing that, or you could video someone, they video you. You could share this link to this video when we send it to other people you know that might be willing to also put in an inquiry. With the inquiry around the changes to the NDIA, they got thousands of people writing, ordinary folks like us. Similarly with ones that recently happened around women's health and epilepsy and so on. We want thousands of Australians to write in and talk about all of the things you've mentioned in the chat, cost and transport and lack of standards, issues around, corruption, equity, homelessness, forensic care. We need all of this going to that committee. So what you can hear from Dr. Freelander is that the committee is really wanting to be able to tell that story, but they can't tell it if they can't hear it from you. So, life gets busy and you might have the very best intentions right now, but just try and find the time if you can to do this. Because it's so important. So if you've got more questions about the how, pop them in the chat. If you want to hear from Sobia, who's done this a couple of times, and get any other tips and wisdom from her, by all means ask. Got any questions for any of us generally about key issues that you want to share? I'll go to the chat in a minute and have a look and see what's there. But this is really your opportunity. And remember, Dr. Freelander's been very clear that he wants CHF to send him everything you say. So we will take that information, de-identify it, so you don't need to be concerned about your name being there. Sometimes several people have made the same comment, so we'll just say this was a comment a lot of people made, right? And we'll get that to his office. We'll send him a link to the video too. We'll send him the poll results. All of these things are things he can use too in his daily conversation when he's talking to the Prime Minister or the Health Minister. This is what I've been hearing today from the community about these issues. We kind of need to give them courage. There are a lot of vested interest, and you've mentioned that in the chat, who will be very opposed to the things this committee wants to do. And politicians don't want to do things that mean they don't get elected again. Let's be frank. So let's make sure they're very clear that the Australian public is behind them in making these changes, and that they will be supported by the public when they do them. Give them that sense that community wants this to happen. That will give the whole parliament a sense that things need to change and that the community is supportive of these changes. I can't tell you how important that will be. It will be very important, not only when the committee comes up with this report, which will probably be lovely, but getting its recommendations funded and through Parliament. That's the tough bit, right? You can imagine a report with all these stories of issues and key things that need to happen. And many of you, like me, will have seen fantastic reports where nothing happens afterwards, right? So we've got to be writing to our local MPs. We've got to be telling people publicly this has to change and that we're behind it. We might even say we're going to vote for anyone who votes for this. I don't know, whatever you can think of. The more government and the whole parliament feels like, your time is up, this needs to be fixed, the more chances that recommendations will be followed and funding in coming next year's budget to make some changes that will make a difference. we've really got to push hard here, and we're hoping that all of you will be able to do that with us. I'm just going to have a look in the chat, or maybe one of my colleagues has put it in the chat.
I might jump in there, Elizabeth, and say that Hope shared in the chat and said it is quite easy to put in a submission to a Senate inquiry, and they usually advise you on how many pages or words. I've put in 4 submissions to date and have been invited to speak at 2 hearings as a health consumer advocate. So thanks for sharing that, Hope. If that gives people, courage that putting in the work, that, their voice was heard and included, and then, to really unpack that, the committee's asked you to come and join and to give evidence. So thanks for sharing that, Hope.
Yeah. And there's also a comment that someone made about, this is already great, but this is just kind of anecdotal evidence. So first of all, politicians listen to stories. But remember that CHF has its National Consumer Sentiment Survey, 5,000 people every year. So that's about to be 20,000 people. And we're asking them about access to care and cost of care. This is academically rigorous and statistically significant numbers in there. So we have really good hard numbers in some of our smaller surveys, and in this bigger one that we can put in our submission to say this is what the country is telling us. So be confident that there will be evidence, if you like, data, whatever word you want to use, to support the stories. But the stories are equally important, because numbers like 40%, 80%, 200 people will not have the same political impact as the stories you tell. So we need both together. These are the numbers, and this is what this looks like for people. And imagine that there's thousands or hundreds of thousands of people having the same experience. Together, that is like the secret sauce for advocacy. So we're doing some more work, but be sure, I think it might have been you, Hope, that might have mentioned that, but whoever it was, that we do have numbers. We've also
Yes, I would.
Sorry,
I would
Sobia,
add. Yes, I would add to the Elizabeth comment. Like, yes, it's true. The common people, they don't have a data, and a small organization, they don't have a data because of the many resources, lack of resources. But the live experience really instrumental when you are submitting a submission. So it's really important. The data is the big organization, they are already providing, but the live experience is give the back of this data and make them as strong. If you share your stories, if you share the live experience in a submission, that would be really, really strong benefit for the data. If only the data is available, it's just, yes, it's value, but the live experience give the life.
Yeah, thank you. That's wonderful, Sobia. Well, we've put into the chat our policy fact sheet. So if you're not sure about some general policy issues and some other resources, there's a few links we've popped in the chat. And when we send an email out to everyone who registered for this webinar, we always send all the links out, and we will send all the information. I think, Lisa, you said like that, how to do a submission, the emailing the link. We'll send all of that out at the end. So if you watch it, you'll see it live, but also we'll send it all to you so that you can then share that with someone else too. Share it with your friends. Have a Barbie where everyone has to put a submission in before they get a snag. I don't know. Do whatever it takes.
And I think I was going to say, Elizabeth, now I'm back on track. Anyway, we won't go there. Technology. I think if we don't speak, nobody hears. Like, you really got to think that, someone else is going to do your story. They're not. No one else can tell you a story except for you, and only you can tell your story. And how people interpret it, what's coming out of your mouth, is what they hear. So don't expect someone else to be able to tell your story for you. Step up, do it yourself, and then you could pat yourself on the back later when you achieve something, which I do quite regularly. Oh, I don't know about pat me, but anyway, which I do quite regularly for my community, and speaking up for my community as I do in rural remote. It's very important to think, no, don't think old mate behind you's going to do it. You do it yourself. And if there's 2 or 3 the same, well, good luck. But then it shows that there's numbers. So please try and do it.
Yeah, thanks. Thanks for that encouragement, Aunty Maureen. Lindsay, you've put a lot of stuff in the chat. Thank you for all of that. You've asked about what's the relationship between this and what's happening in the disability community in relation to the changes to the disability bill that's been going through Parliament. Many of you will be very aware of it. I think that that has a lot of political attention, as it should. And so we need to make sure that these health issues don't end up being smaller. So that's why it's very important that a lot of people talk about that. Obviously, it's possible to both be impacted by specialist costs and also changes to disability funding. So in some cases, people will be putting submissions into more than one place and fighting battles on more than one front. I think for us, it's important that these issues are at the front of the politicians' kind of minds and eyes, if you like. And the more that we tell our stories and so on, then we can ensure that this is considered to be an important issue, because politicians have lots of things on their minds, don't they? There are wars, there's inflation, there's politics itself. So how do we make sure we say, in all of the busyness of your days, this one, you really have to keep it in mind because it's impacting people in such an important way. It is our opportunity, as you said, Sabra, it's our opportunity to talk about what those gaps are that Sobia mentioned, talk about them, and also provide our solutions. My view is that often community already knows what's needed. They just need the resources and, political or other support to do stuff. And so then, so it's really important for us to do that too. Okay, just looking to see if there are any other questions that I haven't answered. There are lots of ways. I think you've made a comment, and there's lots of ways that you can get involved democratically. Submissions are not the only way, of course, but that's what today's about, encouraging that. But absolutely, if you've got other ways that you think you can, get the message out and share with other people, then that's a really good thing for you to do as well. Larissa's talked about governance, and so for us that's about not only having community and consumer representatives in the right places, whether it's hospital boards or funding mechanisms and so on, it's about transparency of that governance. So what's happening in those rooms, what's being discussed, on what basis are decisions being made that are affecting all of our lives, and when lived experience and data is shared, what insights are these governance mechanisms gaining from what we share, and what are they doing about it? So I often talk about this, it's like closing the loop. So maybe there is a committee. Maybe they've even heard stories like the ones we've heard today and the ones that are in the chat. But how do we know what that meant? Did they just go, oh, and then move on? Or did they say, oh, we need to change our policy? Or did they say, oh, we need to put in a submission to our state government for more funding to set up a new service? So I think Larissa, you say proper governance. Like for consumers, I think the governance is first making sure we're part of it, but that's not where it ends. It needs to also include transparency. So if you weren't at that meeting, you know what happened, and that closing of the loop. We don't want to keep yarning on, telling our stories again and again, only to discover that no one's listening or acting on them. But I sometimes call it like compliance theatre, ticking a box. Well, we did hear the story, so we're like almost there, right? So that's good. We want more than that. We want more than we were there. We want to be listened to, and what we count is not the number of meetings we went to. It's the amount of influence we had, the changes we can see that happened as a consequence of us sharing our insights and our stories.
I was going to say to you too, Elizabeth, when you do it yourself, when you pick up your bat and you run with you and you hit your own ball with a bat, you're doing your own thing. Like if you're asking other people, relying on other people to tell you a story in the way you want it to be told, it doesn't happen. So you have to do it yourself to make sure that you get the word across that you want to be heard properly. And when you do it yourself, you can tell your story a million times because it's your story. If someone else tries to tell it, they change the words, they look at it differently, which politicians do. And we're going to change governments continuously no matter what. So when it's your story, someone can knock on my door tomorrow and ask me the same thing and they'll get the same story. But if you ask political parties, they've changed, they've gone, someone else has shifted jobs or whatever, and your story gets lost. But when you do it yourself, it's so important to make sure you do your own story and you fight for your own rights.
Great. So I don't think we've got any more questions coming through. I'm going to now might ask you first, Sobia, because Maureen's just spoken so she can get her breath back. Any last thoughts you have for the folks that are both on with us now, for the people that are going to watch this? Often, 500, 600, 1,000 people might watch this video afterwards. So what are your last kind of advice to people? And then I'll come to you, Aunty Maureen, for the same. So, Sobia, what do you think? Is there anything you'd like to share with people, your last thoughts for them?
Yes, for the submission, I would say I was just now thinking about, there was one, actually we want to submit one submission and we have a really good story, but she doesn't want to share her story. Then I met with one of the minister and she encouraged her and she said, look, if you tell us your story, then we come to know what's happening on the ground. If you don't tell us, how we can know? So I think that's the best thing. If we bring the things in their attention, they can do for us. Yes, there is some barrier, there is some things, but I think our part is to bring the thing in their attention. And then obviously the advocacy method is not just to write this thing and just forget it. The advocacy has a step by step. We need to follow with our MPs, we need to follow with the other politician, we need to follow with that this is happening, bring more people with you. A small step really make a big impact, and we follow this thing. We in PMWN we are untrained, but we make a very good impact and policy change in WA, just because with the lived experience bring together and they work together. So I think that's the best thing. Lived experience is really powerful if you are working in a persuasive way.
Right. And Aunty Maureen, any last words?
Well, I was just going to tell anyone that they're a bit toey about doing this to come and see you, because you'll be the one to be out, or you and Tom, or volunteers, to ask the question, because not everyone is competent to ask the question. I must admit, I'm a part of the Community Health Forum and have been a consumer for a good while, but I find that this group, and not blowing the wind up their skirt, I find this group listen to us, act upon it, and give us the opportunity to speak to the right people, so we're not banging our heads against the wall and we achieve the most of what our time that's spent to do this. So any of you guys out there that want to ask a question to any of us, feel free. It may be you might think it's a silly question. There is no such thing as a silly question. You may get silly answers if you ask me, but you might not. It's not a silly question. And love yous all. Thank you for listening to me.
Thanks so much.
I just want to add one more thing for the CHF. When I was on other platform, we feel like we are just ticking a box, lived experiences here. But when we are in a CHF, we feel really empowered because they are listening. They give us a respect. So I think this is really credit goes to the CHF.
You're both very kind. Thank you. And I'll pass that along to our team. So remember, there's a recording, okay? So we'll send this out and send it along to everyone, right? If you don't already, if you do social media, Instagram, Facebook, or whatever, LinkedIn, we're on those things. We have a small budget. So if you can share everything we do, that helps us get our message out. That's really important for us. Remember, this will be there, but if you've got a phone and you want to take a photo of the links, you can. Otherwise, we'll send you all of this. So don't worry if you can't see it right now. We're going to have our next talk, which will be in December, is about healthcare in regional, remote and rural environments. So 2nd of December, put that in your diary because that'll be really great and you can register for it now. We also have a newsletter, which we'll probably put that in the chat too. Great for you to be involved in our newsletter. There we go. And we also have, remember we talked about data, we have an opt-in research panel called Australia's Health Panel. So if you're thinking, I wouldn't mind also be sharing my stories in that more quantitative way, we can provide a link for that too, and love you to. Then we just send you an email when we've got a survey, and you can choose to do it or not. It's completely up to you. We get varying numbers of people depending on whether the topic's interesting or they've got time. So any way that you can share our story is really important for us. And I would like to give a big thanks to all of my team. It takes a lot of work to do these things. And we've got Tom and Al, Nami, I think James was on the line there, Leah, so many folks that help this make this happen. Who have I forgotten? No doubt somebody who's going to tell me later I didn't mention their name. So apologies in advance. Thank you all for your time. And Emma too, big thanks to you, Emma. And let's see if we can make a difference here, folks, in such an important area. We'll leave the Zoom on for the next 3 minutes in case you think of something at the last minute you want to add in. a question, a last thing you want to say to Dr. Freelander, you can pop it in the chat. Remember, we're going to collate all of that and we'll send it to him. And otherwise, keep in touch with us, because in the next few months, we're going to be doing a lot of work in this space. And if you want to join in, amplify what we're saying or add your voice, then you'll have opportunities to do that. So thanks to our speakers, thanks to all the CHF staff, and thank you to you all for coming along as well. And enjoy the rest of your Thursday.